Are they going to close my child's school again? That's the question I'm hearing from parents all across Ontario, all across Canada, as we're hearing more and more discussion and perhaps momentum inching towards school closures again, something that so many parents are really frustrated to hear about, really concerned about. Well, let's break down the issue. Let's look at what the experts in that field are actually saying. Let's look at what the data actually tells us, various reports and stats that are out there, but I think they have not been reported enough in the media. More parents need to know them and have them in their arsenal as they advocate for their child and for their child's schooling. There was a letter sent out the other month, an open letter from over 100 medical experts in Canada, many of them leading pediatricians from Sick Kids Hospital, Children's Hospital of Eastern Ontario in Ottawa, all the children's hospitals in Canada, saying not only must Canadian schools be open, they must remain open even if there is rising community transmission. Why do they say that? Well, because coronavirus has thankfully proven much milder in children than they first thought. And in fact, they say that the evidence proves that actually influenza is more severe in children themselves than coronavirus has proven to be. So they say the only circumstance in which closing schools would be justified is if having the schools kept open proves to be more directly harmful to the kids themselves. Basically, if kids are getting coronavirus and getting it severely and winding up in the hospital, then that is a justification to shut down the schools. But this very tangential, well, a child may get it, a child may pass it on to a family member, that family member may be high risk and so forth, that doesn't cut it because the documented harms to kids for lockdowns for those kids, they outweigh any of those benefits. That sort of, they might give it to a person who gives it to a person and so forth. Just not acceptable. But what about that question of, well, kids, they don't get it severely, but they are the secret super spreaders themselves. The facts just don't warrant that. Now, we have heard that from medical officials consistently. Ontario's Chief Medical Officer of Health, Dr. David Williams, he has said that when it comes to in-school transmission of the virus happening in the classroom, well, it's actually hardly going on at all. Well, what about these news headlines we hear that this number of cases in schools, that number of cases in schools? Well, there's a problem there in terms of how they're discussing it. A lot of people take that to mean cases acquired in schools, but it's not what it means. It means they've tested a child and that child has most likely got it from their parent, and that child is in the school environment, but they didn't contract it from in the school environment. And then they go and they test the rest of the class, and they often find that nobody else has acquired it. I recently wrote a bit of an in-depth piece into one particular school in Eastern Toronto, where they had identified one student who had the virus, one student, and then they found out it was a new variant. So, well, they were hyper vigilant. And what did they do? They shut down not just that one class, but 3 whole classes, because those were the classes that had a recess cohort. So they played together outside in the playground. So they sent home all of those kids. That was 60 kids, and they sent home all of their siblings who attended other classrooms, 100 kids. That school only had about 300 kids, just over fully enrolled. So they sent home a full third of the class, and they said, you got a full third of the school. You got to go home for 14 days. You got to get tested and so forth. They gave them take-home test kits that they sent home for the weekend. Guess what? They brought those tests back, and they found, guess how many positive cases out of those 300? 0. A full 0. There was another interesting study that Toronto Public Health did. It was a pilot project looking at asymptomatic spread in schools. And they tried to check out areas, schools where there was low risk in the broader community, low community transmission, and then places where there were high community transmission. In the low community transmission, they tested not just all of the students, or as many as they could get to agree to participate, but the parents and the family members as well as the staff. And they found in some of these schools with low community transmission, pretty much 0 cases. The high community transmission area they tested, it was actually Thorncliffe Park, a neighborhood in Toronto that has unfortunately had higher community transmission. They did find quite a few cases, kids in classroom, not that it was spreading in classroom, but kids going to class who tested positive for the virus. But they found that the general family, the parent positivity rate, was greater than the student positivity rate, basically endorsing the idea that kids were getting it from their parents. The parents had it, gave it to the kids, didn't spread it in the classroom. There are studies all across the United States and other countries which consistently show a similar story, which is why actually other parts of Canada, they have less severe measures than Ontario has. For instance, in BC, it is not standard to send the whole classroom home. In BC, one kid tests positive, they don't close down the classroom. They do a bit of investigation to see if that friend had, one BFF who the teacher says, oh, they're always together in close quarters and so forth. Okay, well, maybe that other friend needs to go and get tested and so forth, but it's not automatically shutting everything down. So as parents in Canada watch this kind of odd conversation progress about shutting down schools, whether it's Ontario or in whatever province, you've really got to look at the facts, the granular details, and there's no way anybody can reasonably conclude that there is any justification for shutting down schools again in this country, and there is no serious pediatric expert who actually wants that to happen. Very important facts that parents across this country need to know.